So the question that happens is, why did I stop using the hammer and chisel approach to the nose? I've used hammer and chisel approach for noses since 2002, and I've done this for a long time. And it's not that it's a bad technique, but it's just not as accurate and as precise as other better technologies. And of course, with any technology, there comes sort of a cost and expense for you as the surgeon or a surgical center or what have you. But for the patient, my end goal is to give them the best result that I can physically deliver. And so the traditional approach for doing rhinoplasty is to use a chisel, which is a sharp-edged metal instrument, and then a hammer. The problem with this is that the nose itself is extraordinarily delicate. Many of my females, not all of my patients, but many of my patients are female patients who have really delicate bones. But even my male patients are wanting some changes in this delicate structure where you're talking fractions of a millimeter. The other reason I stopped doing this is because of the control factor. If you think about this, if you ever work on statues and sculptures in marble and other materials, you use a hammer and a chisel really just to kind of start the beginning rough process of chiseling. But once you get down to some of the finer details, you're going to use a different tool. You're going to use some sort of sanding device, whether it's a power sander or so forth, but you're really going to do that so you can kind of create the smoothness to the statue. Otherwise, it's not possible to do that with just a chisel. And I think it's similar with the nose. You can consider starting with a chisel, but there's a reason I don't do that. It's because when you take a chisel to the nose, you have living tissue, and you're sacrificing some of that tissue. You're pulling out some of the membranes and mucosa when you do that. It's not possible just to selectively pull out the area you want to without pulling out these other areas in tissue. So again, for me, I use a couple of different technologies for patients, and these technologies help me smooth out the nose and, most importantly, preserve their underlying soft tissues and overlying soft tissues so that the patients have the most natural noses, at least that I can think of.